So at this time, I'd like to introduce Cecelia, or Cece, Spitznas, who is a Senior Science Policy Advisor in the White House Office of National Drug Control. She will also share some federal efforts and recommendations for states and health plans to implement going forward. Cece.
Hi. First of all, I'd like to thank Leslie at ASHO and Claire and Catherine at the NICM Foundation for inviting ONDCP to participate in this webinar today. I'm delighted to talk with you about the National Drug Control Strategy and the work that we've been doing here on the prescription drug crisis, opioids, maternal addiction, and drug-exposed infants. And I also want to give special thanks to Stephen Patrick, who is a physician at Vanderbilt who has been working with us on this effort. He is one of the people who identified that there was growing concern with this issue, and I'll be talking about his research in a few minutes. And I also want to say that we have a team of people here in the room, including Dr. Kim Leary and Megan Lynch, who are helping to work on this policy issue with us. And I also want to thank all of the participants who are on the line. We're up to over 400 people now, and my mother is a former retired nurse case manager who worked for a managed care organization for a very long time. So I really appreciate the challenges that people have who work in this area, and I'm very glad that there is so much interest. So ONDCP initially became involved with this effort after Florida and also Dr. Patrick published related to this work. And I was in charge of organizing a national leadership meeting that ONDCP held in the summer of 2012. And here are just some pictures from this meeting. And a lot of the credit for getting this work going goes to our former director, Mr. Gil Kurlikowski. He was very excited about working on this issue after he participated in the initial Florida task force that Attorney General Pam Bondi had been in charge of. And in Florida, they were noticing that there was sort of a growing cohort of drug-exposed infants, and hospitals were interested in obtaining more information and better information about dealing with this. So the meeting that we held involved federal partners, staffers from congressional offices, and many of our National Association partners, including Leslie Erdlach from ASHO, who's on the call today. And it was a really good chance for researchers, clinicians, advocates, and policymakers to meet and raise awareness and consider potential solutions for dealing with this problem. And if anybody decides that they want to look at the slides further, that link on the top actually will connect to the White House archive for, I think it's actually the ONDCP YouTube channel. Actually, I think it's the White House YouTube channel that it's archived on. It's an 8-hour-long meeting. It's long, but there's a lot of good content on there. So I recommend that people who want to dive more deeply into this take a look at that. So as I mentioned, Dr. Patrick published a paper in May of 2012 that got quite a bit of attention, and it was published in the Journal of the American Medical Association, and was one of the big reasons why we decided to hold this paper. It was the first, or hold this meeting. It was the first time that we had really noticed on a national level publication documenting that there had been a rise in the rate of diagnosis of neonatal abstinence syndrome births. So from 2000 to 2009, they discovered that there was a nearly threefold increase to 3.4 per 1,000 hospital births. And so this is national data. We've since had an opportunity to work with some other states and to map data related to these diagnoses more on the local level. And in some states, there are much higher rates than this in certain pockets of the state. So that's one of the things that I think is really important to be aware of, is that there can be very spotty, patchy coverage in terms of where hospitals are seeing this and then where hospitals aren't seeing this. So it may not be happening uniformly across a given state. One of the other things that Dr. Patrick noticed, this slide shows the mean length of stay and also the hospital charges and what on average they were. And just to point to 2009, the mean length of stay was a little over 2 weeks for these infants. And the cost of treating this condition is rather expensive. Usually they're treated, if they require medication, they're treated in the NICU in a lot of places. So one of the things that researchers are interested in looking at is whether there are ways to change this and address this cost. This next slide shows the differences in terms of cost to various payers. And I believe it was about over 75%, about 80% of the babies were actually Medicaid babies. And you can see here that the charge is highest in that group. But also that the total charges grew from $190 million to $720 million. And that's a significant change. So obviously that's something that we're concerned about. So for those of you who don't know very much about ONDCP, I confess I only started working here 3 years ago, and I didn't know very much about it a while back either. So our office is a very small office within the Executive Office of the President. And we are charged with coordinating efforts related to drug control across the entire federal government. One of the things that we do is produce a report for Congress every year, and that is the National Drug Control Strategy. And we just released the 2014 National Drug Control Strategy last week. So I would encourage you to go online and take a look at that. But one thing that we also are able to do is to release special policy documents that concentrate on certain areas that we think need more attention. And in the 2010 strategy was the first strategy for this administration. And it addressed treatment, and it also addressed prevention and recovery. But at that time, we were noticing that there was a large increase in the rate of overdose and also the rate of prescription drug misuse that was appearing in the literature. And so we thought that it would be important to develop a prescription drug abuse prevention plan. So we have a special prescription drug abuse prevention plan that was released in 2011, and that is also available on our website. And it was focused on, what additional could we be doing in order to address prescription drug abuse and specifically try to prevent new initiation, new cases. So we had 4 main focus areas for this. And one of the focus areas was education, both in terms of educating the public and in terms of educating practitioners. And we know that prescribers do not, especially in their medical school training and their undergraduate level training, they do not get very much education on pain management or how to identify and treat substance use disorders or people with these problems. So education was one of our pillars. We also had an emphasis on monitoring and using prescription drug monitoring programs to address this problem, to help with people who might be doctor shopping or to help identify people who may be developing a prescription drug problem. We also, the third pillar has to do with proper medication disposal and also proper medication disposal and also storage. We know that a large number of the medications that people admit to misusing, they are actually receiving from friends and family. And there's a lot of unused, unwanted medication sitting around in people's medicine cabinets, and that poses a diversion risk. And that's how people sometimes begin to engage in this problem. And then the final topic was enforcement and strengthening existing laws. And there was a recent CDC report that just came out that looked at how laws have been changed in Florida and what the impact of that has been on their prescription drug issue. So I would encourage people to take a look at that as well. Since we released the plan, not only have we learned more about neonatal abstinence syndrome and the increasing rates of that, but we've also seen more data concerning overdose and heroin misuse. It appears that some people, many people who become heroin users have used prescription opioids prior to becoming heroin users, although the number of people who actually go on to try heroin from prescription drugs is very low. And we've also seen, especially in young people ages 18 to 25, increases in hepatitis C that are concerning. So in the 2014 strategy, we update the prescription drug abuse prevention plan and talk more about these different issues, including NAS. So I would encourage you to take a look at this if you have an opportunity. And the reason that I'm spending so much time talking about the plan is that we firmly believe that states that begin to engage in the activities that are advocated in the plan will start to see decreases in the overall rates of prescription drug misuse. And we are very hopeful that this will have an impact on NAS rates. So that's the first thing that I want to go into here. And also I want to say that one thing that ASHTO has done that has been very helpful, and I'm sure you'll hear more from Leslie about this, is they have taken on the issue of prescription drug abuse for reducing overdose as their presidential initiative for the past year, and they're interested in reducing that by 15% by 2015. And I think that the activities that they have in their plan also will have an impact potentially on NAS rates. So the takeaway from this is that there's some good things that are going on. Now, you know, this next slide talks about categories of maternal drug use that can contribute to NAS. And the one thing to keep in mind is that many people who have a child who is exposed to prescription drugs may be having that because they have a legitimate medical condition that is being treated with opioids. Or also, because it's not only opioids that can contribute to this problem, maybe psychiatric disorder that they're being treated with sedatives for. So chronic pain is an extremely important thing that we need to maintain access to treatment for, as are psychiatric disorders. And two of the treatments for opioid use disorders, methadone and Suboxone, or a medication that contains buprenorphine, Subutex, those are both very useful for treating serious opioid use disorders. And these drugs can cause NAS. So it's probably unrealistic to think that we would be able to completely stop NAS from happening, because there will be some pregnancies in some of these individuals, either unintended or intended. And you know, sometimes this can happen, obviously, from misuse of these medicines or for misuse of somebody else's prescribed medicines. And that's one of the areas that I think it's really important to cut down on. And then, of course, certain Schedule I drugs can also cause NAS, like heroin. And so those are some important things to keep in mind. We're interested in reducing NAS incidence where possible, while preserving access to needed medical treatment. And there have been a number of federal activities that have happened in the past couple of years. An example is that the FDA, the Food and Drug Administration, they actually had a box warning that they placed on extended-release, long-acting opioids, so prescribers would be aware that they can contribute to neonatal abstinence syndrome. And that's an example of a federal action that could take place, a regulatory action that could take place that could have an impact on this problem. Another thing that we think would be very helpful and that people may have ideas about facilitating is efforts to identify women early who might be at risk of having a baby with this problem, and discussing the role of opioids. It appears I am out of time. I'm going to speed it up. Discussing the role of opioids in this issue. In terms of some of the activities that ONDCP, actually, we'll skip this one slide and go to the next slide. ONDCP, along with the Prescription Drug Abuse Prevention Plan, had a number of action items that were assigned to various federal agencies and federal partners. And so these are some examples just from the Prescription Drug Abuse Plan that I think would have some bearing potentially on either health plans for reducing prescription drug misuse, or maybe potentially also on neonatal abstinence syndrome. So in the first example, exploring the feasibility of providing reimbursement to prescribers who check the prescription drug monitoring programs before writing controlled substance prescriptions for patients covered under insurance plans. That's an example of something that could potentially help with this problem. We actually had a meeting in 2011 that looked at evaluating existing programs that require doctor shoppers and people abusing prescription drugs to use only one doctor and one pharmacy. We're also interested in working with CMS, the Center for Medicare and Medicaid Services, and HHS to look at the possibility of using state PDMPs for reducing Medicare and Medicaid fraud. And then we have two more items. One is using developing tools to facilitate appropriate opioid prescribing, including developing patient and provider agreements and guidelines. So decision support tools that would facilitate appropriate prescribing. And then the last one has to do with using screening, brief intervention, and referral to treatment programs to help healthcare providers identify and prevent prescription drug problems in primary care, and working on incorporating the use of health information technologies such as electronic health records into these screening, brief intervention, and referral to treatment programs. And I just want to say we realize that screening, brief intervention, and referral to treatment may not necessarily be all that you need to do with somebody who has a brewing opioid use disorder problem. But we think that this can be really helpful. It's very important to start to identify people who are actively using and to make pathways and linkages to treatment for them. Only about 30% of opioid users in a given year go into treatment. And it's really critical for these women to start making it there. Now, this next slide kind of breaks up what ONDCP can do and what we have done in the past year related to this issue. So, as I said before, we coordinate the federal activity, and there's technical assistance that we can give. We can hold meetings and go to meetings, and we attended we had a vision session at a summit this year on NAS to try to get information from the public about what might be good to address this problem. We also attended a State of Tennessee and Appalachian Regional Commission Experts Health meeting on this, and we have an opportunity. Our director has a little bit of a bully pulpit to engage with the press, and so he went on a visit to Vanderbilt to the NICU and was able to bring attention to the issue there. We also hold convenings, and we recently held one on heroin that the Attorney General and the Governor of Vermont attended. So there's a variety of activities, and the folks here in this room are working very hard and diligently on pulling together an internet resource center where we can have all of the different resources that we've located on this topic together. Finally, I would like to just say that there's a lot of challenges with this issue, but there's a lot of opportunities. And one thing that we identified through our meeting is that it's really important to try to address these consequences without contributing to stigma and making problems worse for infants and families. There's a lot of research gaps and more research that's needed on identifying the best way to address these problems. And obviously, as I mentioned before, with 4 out of 5 newborns with NAS being paid for by Medicaid, there's implications for state budgets, but there's also opportunities to work with states on this. And clearly, we want to do more in terms of educating prescribers, pharmacists, and patients about the appropriate use of opioids, building treatment capacity, and looking at whether there's incentives that we can use in Medicaid or through other insurers to try to address this problem. So I look forward to hearing about the rest of the activities that other presenters are engaged in. And this is just a list of various links. I think that they're all active, and I would encourage you to go ahead and take a look at these as well if you get a copy of the slides. Thank you.